evening and welcome back. So, anti-lockdown protest in Scotland as coronavirus cases rise by 141. And yes, the number of cases doesn't really matter. What really matters is, of course, the number of deaths. And even then, it's an inflated figure by their own records of saying that the coronavirus is put down as the death, where that is inaccurate and largely improbable, if not impossible. But nonetheless, if they wish to report the amount of cases, then through doing so, of course, we can see, oh, we got that many cases, and then we got that many recovered. Oh, they don't give the number of people who have recovered. Okay. But they show the number of deaths. In which case, the total amount of cases and the total number of deaths, and you have to try and work out then the number of people who have recovered, which is very difficult, if not impossible, given that it was, of course, if you've ever been diagnosed with coronavirus, then once you die, you're put down as a COVID death. But it's now been changed for it to last a month, for you to then be put down as a COVID death. And also bear in mind that the vast majority of times, for elderly people at least, the reason they die is massive organ failure, essentially. That is it, or multiple organ failure. But they try and put it down to some other pre-existing condition in order to say why the organ failure was brought about. Either it's heart disease or cancer. They're the primary two. But, of course, now that the Wu flu is thrown into the mix and there are profit incentives there as well, then that's going to be put down as cause of death, and therefore the numbers for the Wu flu causing death are going to be overly inflated. And that's what we're seeing here. So the response has been, well, hey, if we're not at risk, if it's not actually such a big problem, if there isn't any public concern, why are you treating it as if it is? And, of course, it's then taken into, well, okay, let's treat it a fact that the Wu flu isn't a concern for the vast majority of people. And yet, there's a big push to isolate people and to stop them from interacting with each other and smiling. Why might that be? And the reasoning, very quickly, very obviously, becomes political reasoning, in which case the response is, we don't agree with your politics, we want to be able to go about our lives as we see fit. If, on the off chance we should happen to fall ill, we are willing to deal with those consequences as they are. And yes, I am aware that that is more difficult given there's a socialised health system, but at the end of the day, it comes down to individuals, and if they wish to say, well, hey, we want to be ourselves, we want to express ourselves as we see fit, as long as we're not violently causing harm to anybody else, we also wish to take our health into our own hands, then why should they not be allowed to? Provided that people are consistent and saying that we do not want your medical care of the Nationalised Health Service, instead we want our own private insurance, then I do not see the problem at all. They're saying that your policy requires we follow these actions, we don't want to follow these actions, therefore we would like a separate policy. If you're not allowing that separate policy, then again, you're restricting their rights. So if you try and say, oh hey, but everybody needs to follow this because that's how the law works. So, well, the law doesn't sound just, so why is the law there? And they say, well, it's because of the Nationalised Health Service, everybody's paying in, everybody needs it free at the point of service. Right, and what does that policy entail? It entails you wearing a mask and distancing, and not interacting with the ones you love. Well, I don't agree with that policy, I want a different one. And they say, well, you can't have a different one. It's this or none. At that point, for anybody who says that healthcare is a human right, of course they're taking away that right. But not just that, but not only are they saying that you're not allowed access to this particular branch of healthcare, but they're saying you can't have any healthcare at all, which surely then is violating human rights. And there's a poignant but distinct delineation there between the two cases. So, protesters opposed to COVID restrictions, and bear in mind it is the restrictions, the political part, not the virus itself, have gathered in Edinburgh as figures show the highest weekly rise in cases since May. Who cares? At this point, we don't care about cases. It is not the Spanish flu come up again. It is not the second Chinese version of the Spanish, but actually Chinese flu. It was just called the Spanish flu because that was the only country that would report on them accurately. But again, it's Chinese. No, we do not believe it is the same as that, and we should have a right in order to show it. But for whatever reason, of course, you're limiting our protesting capabilities. So, coronavirus skeptics, vaccine conspiracy theorists, and those opposed to mandatory mask wearing staged a rally at Holyrood. That's putting it mildly. It comes as figures showed almost 1,000 people tested positive for the virus this week in Scotland. Again, we don't care. In the past 7 days, there were 994 confirmed cases. The figure was almost double the 507 new cases in the week previous. Doesn't matter. Scotland's National Clinical Director, Professor Jason Leach, described the protesters as deeply irresponsible. But again, we don't care what you have to say. That your so-called cure is significantly worse than the virus or the problem itself. So, no, we don't care. So although he said, I honestly do not understand it. I think it's irresponsible to think we're making it up. 194 countries are making up a viral pandemic. I would love to have not lived through the last 6 months, both in my job and what we have had to do to our country and many others. I think it is deeply irresponsible. And no, I don't think you're making it up. Although, that's probably the closest take I've heard from an authority figure, so well done, Jason. But when you say 194 countries are making up a viral pandemic, it's not the WISIT, it's the World Health Organization, or essentially the Chinese Health Organization, that is responsible for that. So, given that China has been misleading the World Health Organization every step of the way, then I think we've got reason to distrust what the World Health Organization is saying in parroting what the CCP want them to say. And we have many fears and concerns about what the CCP are trying to push across, in which case, yes, we think that they might be making it up. And then when it comes down to what the evidence actually shows, especially in places like Sweden, of course, and even out to Japan, then we are concerned that your reaction is a severe overreaction, and we do not agree with the action that you've taken, and that is what we are protesting. It is as simple as that. So at what point do you admit to say, okay, fine, in your words, if you wish, these people do not care about their own lives, in which case they have to deal with the consequences. Go on then, all yours, you're on your own. When do you make that choice? Because for a lot of people, that is incredibly preferable. And if you allow people to make those decisions, then you wouldn't see this concern. If, for example, you were to say, we're concerned about this virus, here is what we suggest, there you go, then you would not have a problem. But it is when you mandate particular things and force people to do things against their will, which is when you get the problem. And that is what people are protesting against. It isn't the virus in and of itself, it is the measures that you've put in place by law and mandate and forced people to comply with that they're having a problem with. It really is that simple. So as they say, hundreds of protesters marched to the Parliament building in Edinburgh with flags and placards for the Scotland Against Lockdown protest, organised by the Saving Scotland Facebook group. A post advertising the event said it was time to stand up together and listen to real scientific evidence in regards to the health of the Scottish people. The group said lockdown was causing more harm than the virus, and that Scots should say no to mandatory vaccines and masks, no to secondary lockdowns. Police Scotland said it had been aware of the demonstration and that officers had provided a proportionate response and no arrests had been made, which is brilliant progress. That people are protesting, they're saying we don't care for your laws, they are disobeying the law, of course, with their mass gatherings and lack of PPE, and yet no arrests were made, which shows a weak government because they are not enforcing their laws. But at least in this instance, it's for liberty and freedom, and I think we can all get behind that. They're not causing any harm to anybody else, they're not forcing anybody else to be there, they're not forcing themselves upon anybody else either. In which case, it's perfectly fine. If they were to say, hey, we want to be able to infect people without them knowing and against their will, then there would be a problem. Unless, of course, it's AIDS in California, in which case that's perfectly legal. Funny how that works. But nonetheless, that's how the law stands over there. But that would be different. But instead of saying, hey, we wish to get on with our private lives and do things our private way without other people forcing us to adhere by their rules, then, yeah, that is perfectly fine. And how on earth can you say that customers of supermarkets or stores or shops have to wear masks, but the people who work there don't, given that they're the workers who are interacting with the most people, and if you're so concerned about asymptomatic carriers, then they're going to be infecting everybody else, and the mask is there to stop the spread, and not to stop the receiving of it. In which case, those workers, chances will get infected by somebody somewhere somehow, and then spread it to everybody else. But that's okay, and that's not causing a problem, almost as if COVID-19 isn't such a problem, and the Wu flu is a little bit overblown. But thankfully, no arrests were made. So well done, Scotland. You've actually done something right. But as always, let me know what you guys think down below. When does, that's the question of the day then, when does the point of libertarianism and being an individual, of being able to do what you want to do without harming others, then cross over to the line of harming others when it comes to infectious diseases? How far can you push it of not being told what to do before then risking other people's health by doing what you want to do without regard for other people's instructions or orders or requests? Let me know down below. Always intrigued to hear what you guys have to say. But as always, until next time, have a good one.